Change the focus here. If I was a student today, I was a 22-year-old, and what are some things I should be doing now? You talked about various courses, negotiation courses, and that sort of thing. What are some things I should do to supplement my speech path degree, or my blindness degree, or my nursing? What other additional things should I be doing?
You know, everyone, I'm probably straight away from your question, everyone loves a well-rounded individual. Everyone. When I say everyone, whether you're sitting at the dinner table, you know, whether out for drinks, or you're sitting down in a hospital setting negotiating a care plan. The more breadth of knowledge you have as an individual, the better you are. It's that simple. So what you can do, if you've already gone through the process of spending time and understanding the process of negotiations, understanding how to solve problems, understanding root cause analysis, you know, things that are so important to everyday decision making, take a liberal arts course. Become more well-rounded. Because everyone wants to be around individuals that can talk about things. And I know that sounds trite, but it's real. It's real. You know, no one understands the benefit you have these buildings around you leave. Once you leave the campus, that's when you really understand, my goodness, what an opportunity I had. I could take that arts class, I could take that literature class, and instead, you know, I decided to blow it off. You'll regret that 6 months after you leave. Trust me, if you don't do it. 6 months after you leave, you'll say, darn, I should have done that. So, in addition to those other disciplines that I mentioned, I would go after any course that can make you a better individual and well-rounded. Be able to talk about, you know, French Renaissance art. Such thing as French Renaissance art.
Sounds good. So.
Does your organization offer student opportunities, internships, or things like that? And how would students go about?
Sure. The question is whether my organization, I'll take a moment to talk about my organization here, offers internships. The answer to that is yes. The company in which I have the fortunate opportunity to lead is called Emerging Medical Services. We are a New York Stock Exchange publicly traded company. And so our mission is real simple. It is about the patient. We treated last year 11 million patients. That represents 3% of the total population in this country. We touch their lives. And I always use this phrase, touch their lives, because that's what we do. We make a difference by touching the lives of people we are involved with. And that goes from my EMT paramedic on an ambulance to my anesthesiologists that are delivering care in the emergency or in the anesthesia division of the surgery department in a open heart surgery. That's a big spectrum. What we do at EMSC is we provide ambulance services, we provide management of emergency departments, management of anesthesia/surgery departments, hospitalists, which we manage inpatient care, radiology. We essentially manage hospital-based physicians. And it was through the management of those entities that I realized that this world is one of silos in healthcare. Because if you want to talk about silos, go into the emergency room and then see if you can get coordination with the laboratory or with radiology. Those are just like this. And we're actually part of a demonstration project with the Centers for Medicare and Medicaid Services of looking at patient care continuum across hospital care by integrating these individuals. And so, you know, I think, you know, our company, my company, is really on the cusp of healthcare delivery because we're about now focusing on patients' experience in the acute care setting, not as much on the post or pre-care. Yeah, there are many opportunities. The opportunities are primarily around provision of care in the emergency services, anesthesia, radiology, pre-hospital care, ambulance, and we now have started international operations, which we're going to expand that a little bit more and get into home care. But if you're interested, I'm sure that school will have different services to tell you how to get a hold of the folks in the organization to do so. Other questions? Yes, sir.
The skill sets that you outlined at the beginning all are strong communication traits. How many professionals have you worked with in the past that have degrees in communication? Is that something commonly find, or?
When you say work, I've worked with a lot of people with degrees in communication, but obviously if you're a physician, you're a nurse, you're a therapist, your degree generally is in that discipline. We have within our organization 16 people with degrees in communication. And their role, you may say, okay, is their role to put out public relations statements? No, not at all. Their role is to be an integral part of how to get the folks that are disciplined in nature communicate. That's part of their role. I only need 1 or 2 people to do public relations. Not to downplay public relations, it's important. But I need a fair amount of people to work with my providers to have them understand, how do you communicate? How do you spend time and not only share the discipline-specific information about that patient, but how are you part now of a multidisciplinary team that you take in consideration everything that's been said, everything that's been done, and simulate it and represent your discipline in that discussion. That's the rocket scientist. You know, communication is everything. It really is. The ability to articulate the needs of that patient as represented by your understanding of that discipline. That is so important. I can't underscore it. Okay. I think what you see is more and more organizations are looking to folks that are experts in the area of communication. There was a hand over here somewhere, or somebody just waving? Yes, sir.
What's your biggest growth area?
Right now, and I think you were saying growth for my company?
Yeah, for your company.
Our biggest growth area is that last initiative that I described, where we're taking our emergency physicians, our practitioners that also include the other professionals, our anesthesiologists, our hospitalists, our radiologists, and we're saying, okay, we're not going to pass that patient like a football anymore. What we're going to do is we're going to basically focus the care of that patient with everyone around the table. Now you may say, well, that's not rocket scientist. And well, listen, you sit down with a bunch of clinicians and try to get them to listen. You know, old cliche, the brightest people in the world, the ones that don't talk are the ones who listen. And to try to get them to sit down for 25 minutes and listen is rocket science. And that's our biggest initiative, because we're doing this now nowhere in the country. Nowhere in this country is it done. Oh, I take it back, with the exception of one entity, and that's Kaiser Permanente. That's a model right there. If you want to study healthcare, where it needs to go, study Kaiser Permanente. That's where healthcare is really going. They've got it. They've got the answer. They've got the formula. They've got it down. Unfortunately, you know, they don't have a big voice in Washington, and they don't understand the importance of representing themselves with Senate Finance or Health Ways and Means. They just believe in what I said at the very beginning. That's about the patient and healthcare, and they don't believe in lobbying, which is unfortunate. Other questions? Yes, ma'am.
Do you see healthcare going more towards preventive healthcare as opposed to fixing it after it's broken healthcare?
Well, you certainly described our healthcare system, because it's really not healthcare, it's sick care. The United States should never use the word healthcare until we change it. It's sick care. Back in 1972, I was at Mount Sinai Medical Center, and that's a few years ago, folks. And this notion of wellness and healthcare delivery before the patient got sick came out, and everyone got so excited about it. Everyone got so excited about it. Said, my goodness, we just focus on preventing. We don't spend these dollars on fixing. You know, it's like preventive maintenance on the car. Everyone knows you bring for the oil change, it's going to